Hi there. I'm here to help you learn about your health. Please remember, I am an AI educator, not a doctor. Always check with your healthcare team before making changes to your routine. So, today, we're going to talk about something really important, but we're going to do it in a simple and clear way. We're going to talk about understanding colon cancer. So, let's start with a really powerful thought. What if we could stop a cancer before it even has a chance to start? I know it might sound a little too good to be true, right? But believe it or not, with colon cancer, that's something we can actually do. And that's really what this is all about, giving you the knowledge so you can feel empowered about your own health. Okay, so first things first, let's break down the basics. Your colon, well, that's just another name for your large intestine. Now, sometimes these little growths called polyps can form on the inside wall. Just picture them like tiny, tiny bumps. And, most of the time, they're completely harmless. They just hang out and don't cause any trouble. But, and this is the important part, over a really long time, some of them can slowly change and turn into cancer. And that's why we pay attention to them. And right away, I want to share some really good news with you. When colon cancer is found early, before it has a chance to go anywhere else, the 5-year survival rate is about 90%. That's a huge, hopeful number. It really shows just how much of a difference catching it early can make. So you might be asking, okay, how can I get ahead of this? Well, it all starts with understanding what things might increase your chances of it developing in the first place. You'll hear doctors call these risk factors. And just knowing what they are, that's a huge first step in protecting yourself. If you look here, you'll see it's usually not just one single thing. Age is a big one for sure. Most cases happen in people over 50. Then there are lifestyle choices, things like your diet or smoking, those play a part. And sometimes it's in your genes, maybe it runs in the family. Other health issues can play a role too. The main thing to remember is that it's often a mix of these things working together. Okay, let's shift gears and talk about something really important: listening to your body. It's so key to notice when things feel different. But, and this is just as important, we don't want to immediately jump to the scariest conclusion. So this next part is all about understanding the signs in a calm, clear way. So what exactly are the signs to look for? It's a great question. And honestly, the answer might surprise you. Because in the very early stages, there are often no symptoms at all. Zero. That's why those regular checkups are, without a doubt, the most powerful tool we have. But, as things progress, your body might start giving you some clues. You might see some bleeding, either bright red, or maybe your stool looks very dark. Or maybe you notice your bathroom habits have changed and just stayed that way. It could also be belly pain or cramping that's new and doesn't seem to go away. Some people find they're losing weight without even trying, or just feel wiped out all the time. Again, these aren't things to panic about. They're just things to notice and, mention to your doctor. But I really want to stress this next point because it's so important. Seeing one of these signs does not automatically mean it's cancer. Not at all. There are so many other, way more common issues that can cause the exact same symptoms. Yeah, take a look. Something as common as hemorrhoids can cause bleeding, or a condition called diverticulosis. That can bring on cramping. And lots of people have IBS, which can totally change up your bathroom routine. See what I mean? The takeaway here is super simple. Please don't play doctor and try to guess what's going on. That's what your healthcare team is for. They can help you get real answers. All right, now for my favorite part. Let's talk about the most powerful and, honestly, the most positive part of this whole conversation. We're going to talk about how we can get ahead of this problem, sometimes before it even becomes a problem at all. And it all boils down to the power of early checks. This procedure right here is a colonoscopy. You'll hear it called the gold standard. And there's a really good reason for that. It's not just a test to find cancer, it's actually a tool to prevent it from ever happening. Think about it. The doctor can find those little polyps we talked about earlier and just remove them right then and there. It literally stops a potential problem in its tracks. I know. The idea of a colonoscopy can sound a little intimidating, so let's just walk through it. It's really just 4 simple steps. Step 1 is the prep. That just clears the way so the doctor can get a good look. Step 2, you're given medicine to keep you comfortable and sleepy. You won't feel a thing. Step 3, the doctor uses a tiny little camera to look inside. And step 4, this is the amazing part. If they see one of those polyps, they can usually just snip it out on the spot. Done. This right here says it all, doesn't it? The goal of screening is to find and remove polyps, not just to find cancer. The whole point is to get that harmless little polyp out of there so it never ever gets the chance to turn into something serious. It's all about prevention. Okay, so besides those important checkups, what can you actually do in your day-to-day life? Well, the great news is there are a ton of simple, powerful things you can do to take control and protect your health, starting today. First up, and this is the big one, get screened. The recommendation now is to start having regular checks at age 45. What you eat makes a huge difference too. So think about loading up your plate with colorful fruits, veggies, and whole grains. Getting your body moving with regular exercise is also a game changer. And of course, trying to limit things like red meat, processed meats, and smoking, all of that can really help lower your risk. So if you take just one thing away from our chat today, I hope it's this. You have so much power when it comes to your health. So as we wrap up, I just want to leave you with a little question to think about. What's one small step, just one, that you can take for your health this week? It doesn't have to be huge. Maybe it's just adding a side of veggies to your dinner tonight, or going for a 10-minute walk. Or maybe, just maybe, it's making that call to schedule a checkup. Remember, knowledge is power, and you've got a lot more of it now.